HealthBreak is brought to you by Providence.
Celiac disease is a genetic condition in which a person is allergic to the protein gluten, which is present in wheat and many other foods. Dr. Elizabeth Stegmaier describes the symptoms.
The classic symptoms are usually loose bowel movements or diarrhea, but there can be a lot of other symptoms such as headaches or fatigue, weight loss. Sometimes there's a skin rash.
A person may have some of these symptoms without true celiac disease. Doctors call this a gluten sensitivity, but the only way to know the difference is through testing.
Prior to making any dietary changes or removing any large food groups from your food choices, my recommendation is to talk to your doctor and to get tested for celiac disease. The first step is typically a blood test. If you're not eating gluten, then the blood test is not going to be accurate because your body will not be making the immune response that it typically does when you're consuming gluten. The second would be an endoscopy, looking for damage to the small intestine. Both the blood test and the endoscopy are not accurate if you're not eating gluten regularly. Most people don't have celiac disease, but it's a condition that is very important to know if that's your diagnosis. It's important for first-degree relatives, and it's important for family history.
To find out more, visit montana.providence.org.
HealthBreak is brought to you by Providence.